Okay, so good afternoon, everyone. Today's topic is management of colorectal malignancies. I am Dr. Shagun Agarwal, and we'll be discussing about the screening, about the radical surgeries, along with neoadjuvant therapies, the palliation therapies, and something that is never discussed in most of such classes is how to manage the hereditary colorectal malignancies. So yes, in detail, we'll be studying about the FAPs and the HPCCs also. So this lecture will aim upon the reviewing the epidemiology, the risk factors, and the genetics of the colorectal cancers, understanding the screening and how to detect the cancers early and the strategies behind them. We'll discuss the surgical principles in colon and rectal cancers, and we'll also explain the neoadjuvant, adjuvant, and the multimodality therapy. Then we'll address in the end the management of advanced disease and palliation. So we've discussed in the general class of surgical oncology and in most parts of gynae oncology about how are such advanced cancers managed. Even in the endoscopy class, we talked about it, but here we'll just be focusing on the colorectal malignancies and discuss in detail about them. And by the end of this session, you should be able to identify the patients who are at high risk for colorectal cancers. It could be people from general population. It could be people who have a family history of such malignancies, genetic syndromes, understand the screening guidelines and diagnostic pathways, which test to order when and in which patients, when does genetic counseling come into play, all of that, describe the principles of radical colorectal surgery. So when do we go for minimally invasive to maximally invasive, and explain the importance of total mesocolic excision and sphincter preservation. And then in the end, we'll plan the management for locally advanced and metastatic disease. And then in the end, approach the palliation and end of life care appropriately. So the section 1 is about the overview of colorectal cancers, the epidemiology. Well, it is the most common cancer worldwide, and it lags behind just breast cancer. But if we take into account the Eastern countries, then yes, it is one of the most common cancers. And the incidence is definitely rising, especially in the younger population. The major cause for cancer-related mortality is because of this type of cancer, but early detection significantly improves survival. So the risk factors would include modifiable and non-modifiable. Non-modifiable would include increasing age. As the age increases, the telomeres keep on getting accumulated, and then the risk for colorectal cancers increases. Family history, if the patient has a positive family history of colorectal cancers, then yes, they are at higher risk. And genetic syndrome, if the patients are part of such genetic syndromes like HNPCC and FAPS, which we'll be just discussing, then they are also at high risk, and you can't really modify these factors. But the ones that can be modified, and actually the majority cause for this cancer is patients who are taking low fiber and high fat diet, patients who eat a lot of red and processed meat, so those salamis and all those meats that you eat that are packaged are again put you at higher risk for colorectal cancer. Obesity, definitely, just like breast and endometrial cancer, even colorectal cancer is associated with obesity, and also renal cancer. Smoking, yes, definitely. Alcohol and a sedentary lifestyle. And somehow you'll see that people generally have.
Colorectal cancer is one of the leading causes of cancer-related deaths worldwide. Risk increases with age, family history, obesity, and lifestyle factors. Early screening through colonoscopy can detect disease before symptoms appear. Removing precancerous polyps can prevent cancer from developing. Accurate staging determines the most effective treatment strategy. Surgery remains the primary treatment for localized tumors. Chemotherapy may be used to reduce recurrence and improve survival. Targeted therapies and immunotherapy offer new hope in advanced cases. A multidisciplinary approach ensures personalized and comprehensive care. With early detection and timely management, outcomes can significantly improve.